So, Diane, can you see from there if I zoom it? Or if it's far, you can see maybe there. So, pelvis. Basically, I just told you that to cover the bones of the pelvis and the joints, since it's from last year on yourself, I sent you the pictures, and I'll send you also the picture later. Now we just straight.
That
move
picture is enough for the...
Yeah, it should be enough. So straight, we're gonna move to the pelvic cavity. So what I'm gonna do, let me do something, so I can draw stuffs, so you can see it on the screen record. I will send it to the Notability. It's gonna be better. Create new. Oops.
No, it's okay.
It's okay.
Change it
Oh,
here.
wait. Oh, that's right. All right then. Let me see.
No,
It doesn't matter. So here we've got the pelvis. Okay then. So what we get to talk about the pelvic cavity as a general thing that you have to know. The thing is that pelvic cavity is the continuation of the abdominal cavity. That's why you can call the whole thing as abdominopelvic cavity. So the pink area is belonging to the abdominal cavity. The green area as the whole thing is the pelvis. Now, from last year, maybe you did a bit of it, that you can divide the pelvis into the greater pelvis and lesser pelvis. Okay? So, how would you define the border? The thing is that if you're looking at the sagittal section here, you're looking at the pubic symphysis here, and here you got the, let's say, promontory of the sacrum. You know, the prominent part of S1 vertebra. So then between them you have this plane which is formed, this guy. So this is called pelvic inlet. Pelvic inlet, which I will talk about its borders, it's the area which is separating the greater pelvis from the lesser pelvis here. Okay? So now, greater pelvis, the other name for it would be false pelvis. Lesser pelvis, the other name for it will be true pelvis. Why? Because greater pelvis actually contains the lower part of the abdominal organs. For example, in the large intestine, we learned about cecum, or terminal part of the ileum. Appendix is on the right side, in the right iliac fossa. So greater pelvis is the area related to the iliac fossa. As you see here, that's the coronal section. So here you would have, for example, like this. You would have the cecum and appendix and then ascending colon, right? Then on this side, you're gonna have the descending colon and sigmoid colon, something like that, until you reach to the rectum down here. All right? So the thing is that greater pelvis contains the lower parts of the abdominal organs. Lesser pelvis or true pelvis contains the proper pelvic organs. Urinary bladder, urethra, let's say parts of the vagina in female, or uterus, what else? Ductus deferens, and things like that. Which one? And prostate gland as well.
No, scrotum is...
No, scrotum is down there. Is part of the perineum, so it's out of the cavity. So the thing is that this is pretty much of the basics of it. Now, if you're looking at this picture now, so you've got this kind of line around here, this guy. This is going to be the pelvic inlet somewhere here like that. Basically, if you want to define the borders for the pelvic inlet, you're going to have the promontory of the sacrum, okay? At the sides you have the wing of the sacrum, which is on the sides of the body. Then on the hip bone, on the ilium and pubic bone, the pubic bone is cut. You've got a line called as linea terminalis, okay? So there is the linea terminalis running like this, okay? There is an arcuate line on the ilium, and the continuation is gonna go over the pecten pubis of the pubic bone, something like that. You will have the, let's say, pelvic inlet to be formed. At last, you will get to the upper part of the pubic symphysis. Okay? So this is pretty much about the pelvic inlet. One more thing. If you're looking at the pelvic cavity and abdominal cavity, you can see that the axis of the abdominal cavity is just straight running downward. But the thing is that once you're passing through the pelvic inlet to enter the true pelvis, so you see that the axis of the pelvis is curved, is not something straight. How is it formed? So from the very beginning of the pelvic inlet until the pelvic outlet, which we will talk about it. So if you, from each point, from each, let's say, few millimeters or whatever like that, you get the middle point of the pelvic cavity. Because you know the, let's say, pelvic cavity here is narrower than here, for example, right? So it's obvious on this view especially. So then you get the midpoint of the pelvic cavity from each side, and then those points are connected to each other. And that forms the axis of the pelvis, which is something like that. Okay? So midpoint here, then this distance till here is longer, so the midpoint is going to be here. So you know, that's how you form the axis of the pelvis. So axis of pelvis is not vertical, it's curved.
How do you say the borders of the axis when you want to
So
talk about
midpoint of the pelvic cavity between the anterior and posterior wall.
Okay.
So you draw a line and you find the half point, and that's it.
Then you curve it.
What
It
do you-
becomes curved. So if you connect those points together, it becomes something like curved. Are we good?
Oh, but what do you mean by pelvic axis or axis of the pelvis?
So the long axis of the pelvis, let's say, on each part, let's say, through the basically the abdominal wall until the vertebrae is quiet of constant distance here.
Mm-hmm.
So there is a straight line coming downward,
Okay.
passing through the abdomen. But in the case of the pelvis, like the distance always varies between the anterior wall and posterior wall. That's why the axis of pelvis becomes something like curved. It's not straight like the abdomen. Let me get the light more. Alright. Any question about this?
No.
So, we talked about the greater pelvis and everything is written here about them. What have we got here and blah blah blah. Lesser pelvis, as we said, is located between pelvic inlet and pelvic outlet. Okay? So, below the pelvic outlet, you're gonna have the perineum, which is located because you're passing through the pelvic cavity downward, and basically down here you have the skin. Alright? And let's say in the case of the male, you will have the scrotum hanging down, or you will have the penis, or you will have the vulva. So the thing is, down here below the pelvic outlet is the perineal region. So it's something totally different than pelvic cavity. Now the thing is that on the specimen, the lower limit of the pelvis or pelvic cavity is the pelvic diaphragm, which forms the floor of the pelvis. So there are two major muscles joining with each other, or like sitting next to each other, and they form the pelvic floor or pelvic diaphragm. And the thing is that the pelvic diaphragm is not straight. It's looking like a bowl down here. Okay? So on the specimen, you're gonna see this perfectly. On the specimen of the pelvic, let's say, bones, ligaments, and this muscle is there like really nicely. Now let's continue. If you wanna mention the borders of the, let's say, pelvic cavity, before that, we're gonna move to something. So can you see here? Let's say here's the pelvis of the female and here's the pelvis of the male. First of all, if you have the specimen in your hand, the first question they ask you would be, is it male or female? Before they ask you, you say which one is that. So it just goes with the angle below the pubic symphysis. It's called subpubic angle. So the subpubic angle of the male is much sharper than the female. In the case of the female, is wider. Why is it like that? Because female is the one to give birth. So since the baby is going to be passing through, let's say, the pelvic inlet, which is over here, this guy, and then out of the pelvic outlet until we get to the perineum and out of the body. So then these, basically the pelvis of the female is wider than the male's. So then subpubic angle of the female would be, let's say, the angle between the thumb and the index, if you place it there. The subpubic angle of the male is going to be the angle between the index and middle finger. So there's much less of angle between these two guys or these two guys. And you can try it, it's perfectly exactly like that. So the table is here, you don't need to learn anything or all of it, just the pubic, or the subpubic angle in the case of the male is like 70 degrees and in the female is more than 80 degrees. So the table is there. The rest of it, don't waste your time on it. Okay? Now, again, that's a really good picture to show you the pelvic inlet. So up here you have the ala of the ilium on each side. So here is going to be the greater pelvis. Okay? And now, what have we got here? Promontory of the sacrum, ala of sacrum, arcuate line, and pecten pubis. These guys are forming the linea terminalis until you reach to the pubic symphysis. So this line is going to be the pelvic inlet. So up here is greater pelvis, down there is going to be the lesser pelvis or true pelvis. Good?
Which one's the arcuate line?
Arcuate line, I will show you. This bit on the ilium, like this bit, and then it's going to be continuous with the pecten pubis of the pubic bone. Then the whole thing is called as linea terminalis. Are we good?
Mm-hmm.
Okay then. So now, let's talk about the borders of the pelvic outlet. That's also something which worth talking about, because that's also important. Let me find a good picture of the pelvic outlet. I should move to perineum. Let me see. Oh, okay. Let me just see. So pelvic inlet is here. All right then. So one more thing I have to tell you.
Teach us to measure
Distances.
the ones that you sent us. I don't remember what.
We will talk about them later. So one more thing I tell you. Here is the ramus of the ischium. This is the inferior ramus of the pubic bone. So these guys are connected to each other. So the thing is that these guys back there, once two hip bones are connected to each other, they form an arch, like that. Okay? And that's called pubic arch. The name is on it. So once these guys are connected, so back there, if you look at the superior view, you're gonna have the pubic arch. So just keep that in mind, because that's a really important thing for you. If you want to talk about the pelvic outlet, this picture is quite good. So the thing is that you will define the anterior borders, lateral borders first, and posterior border. The thing is that the posterior border is obvious, it's tip of the coccyx down there. Okay? Because you're looking at the pelvic cavity here, where you're looking at the diameters. So tip of the coccyx, which is the lowest part of the pelvis, is the posterior border of pelvic outlet, the end point of the pelvic cavity. Anterior border is going to be the pubic arch, as you see here, where those ischiopubic rami, they join together. Laterally, you would have the ischial tuberosity, which is not in this picture. But I remember that I was always moving myself. Ischial tuberosity is the bony process of the ischium that you're sitting on it. So ischial tuberosity would be somewhere, say here and here. Okay? So they form the lateral borders of the pelvic outlet. And posterior lateral borders, you can mention a ligament like that. You remember it? Sacrotuberous ligament. Basically, the inferior margin of the sacrotuberous ligament forms the posterolateral border. Okay? Let me get to a picture from Sobota, because I remember there's really nice pictures. this one, not skull. There it is. So here's a posterior view, alright? What have we got there? This is a pubic symphysis, so here's a pubic arch. The whole thing here, okay?
So
Then
that's
laterally,
the anterior border.
that's the anterior border. Tip of the coccyx is posterior border. Lateral, ischial tuberosity. Posterior lateral is sacrotuberous ligament on its inferior margins. The lower limit of the sacrotuberous ligament. So then, if you look at this guy, this is the inferior view. So that shows you the pelvic outlet. The head of the baby is coming out of here. So again, tip of the coccyx, pubic arch, over here the arch you see anteriorly, sacrotuberous ligament, and ischial tuberosities on the side. Good? So these guys, I'm going to take a screenshot of this. Okay. I'll take a screenshot of this one so I can send it to you. Okay then. Is it clear? So, let's get to the borders of the pelvic cavity itself. After knowing the lesser pelvic inlet and outlet, so you know the upper and lower boundaries of the pelvic cavity. Now, we get to see the actual borders of it. The thing is that here's the superior view of the pelvic cavity, alright? So the sacrum is being cut from its superior side. Down there you have the coccyx, this guy. Here's the sacrum. Here's the ilium or iliac fossae on each side. Pubic symphysis, you can see everything of it. And down there you have the pelvic floor with the rectum passing through it. Okay? So this is the superior view. So if you have the specimen of the pelvis in your hand and you look at it from above, that's exactly what you see. Now, there is an anterior inferior wall because we said that pelvis was obliquely located, if you remember. Okay? So, anterior inferior wall is formed by pubic bones. It's obvious. So here and here you have got the anterior inferior wall. Alright? The lateral walls are formed again by the hip bone, more specifically, where you have the obturator foramen. I mean, you don't see it here, but obturator foramen would be somewhere there. It's covered by a muscle, which is obturator internus muscle. Can you see this guy? So obturator internus, and you remember the obturator foramen, within that you have obturator membrane. So if you want to go from the bone toward the muscle, you have the hip bone, pelvic surface of the hip bone on the lateral side. Then you get to the obturator foramen. Within the foramen you have the membrane, which you don't see it here. And then you've got the obturator internus muscle attaching to the margins of the obturator foramen.
This is a superior view, right?
This is a superior view. And then what have we got? There is an opening right up here. That's the obturator canal. So where the obturator nerve and vessels are passing through it. Through the obturator foramen, let's say toward the thigh, toward the medial compartment of the thigh.
Where
So
is the attachment of it inside the pelvis?
The obturator internus, the margins of the obturator foramen.
Just it?
That's it. Now, that's pretty much about these guys. So this was a lateral wall. Posterior wall is basically more of bony structures to form it. Easy. You've got the anterior surface of the sacrum and coccyx. Okay? That's the posterior wall. You also have a posterolateral wall. So posterior wall, you can mention it with posterolateral wall. If you see from the sacrum, you've got a muscle running laterally and disappears. Runs toward the gluteal region. So that should be the piriformis muscle. Because piriformis muscle, back in the time when you were doing the lower limb, you remember the greater and lesser sciatic foramens? Here would be the greater sciatic foramen, where you have the notch above the sacrospinous ligament. Okay? So here you have the greater sciatic foramen. So the piriformis muscle in the lower limb, it would come out of it here. Let me just get a screenshot like this. So you're gonna have, can you come closer so I can make it easier like this? So here you would just see something getting into the gluteal region like that. This would be the piriformis muscle toward the greater trochanter of the femur. And if you remember, you would form exactly suprapiriform foramen and infrapiriform foramen, or hiatus. Good? Down here you have the sacrospinous ligament, this guy. So here you have lesser sciatic foramen, where the obturator internus, it's tendon from the pelvis, so obturator internus would be inside there, like that. The muscle is passing in front of the sacrotuberous ligament, that's more on the lateral side. And then it would pass toward, again, the femur. Okay? So obturator internus is passing through lesser sciatic foramen to the gluteal region. Piriformis is passing through greater sciatic foramen to the gluteal region. So,
That's posterior lateral wall.
yeah, posterior lateral wall, which is piriformis muscle. But the thing is that piriformis muscle is not there alone to form the posterior lateral wall, because you've got muscles, which is piriformis muscles on each side, and there is also ligaments, which you would mention. The ligaments which are forming posterior lateral wall, you already know them actually. Sacrospinous ligament and sacrotuberous ligament. So sacrotuberous is this guy, sacrospinous is this guy. They are also forming in or contributing in formation of posterior lateral wall. So check it out from inferior to superior. Let's see what's the order. You have the sacrotuberous ligament, then sacrospinous ligament. Then what have you got? Piriformis muscle forming the posterior lateral wall of the pelvis, and more superior to that, I'll show you a picture. This is anterior view, right? Let me see. Let me see if there is. Okay, this is much better. I love this. So what you're gonna see over here is that here's a sacrum. So first of all, you have from inferior to superior, sacrotuberous, then sacrospinous. Then what else you got? Piriformis muscle like that, running toward the gluteal region. And what is this ligament? Anterior sacroiliac ligament. Part of it also forms the posterior lateral wall of the pelvis. So these four structures are forming it. Make sure you know these two ligaments, sacrotuberous, sacrospinous, which are the major ones that you have to know it from last year, and piriformis. If you don't remember the anterior sacroiliac, not a big deal. Make sure you will know these two ligaments plus the muscle.
What about the ischial tuberous? Or ischial something? Ligament?
No, we haven't.
You don't have?
No, we don't need that. So, are we good so far? So this was pretty much about posterior lateral wall of the pelvis. Actually, let me draw it. So I will save it here. This is gonna be piriformis. I'll save it. All right then. One more thing. If I go back here, that's a quite good picture. If you look at the, let's say, if you have the lateral view of the pelvis. So this is the posterior wall, right? I just told you that it's formed by the sacrum and coccyx. Now the thing is that you will see the promontory of the sacrum. And you see the sacrum is kind of curving, or let's say it's anteriorly is concaved. Okay, so there is a curvature going like this. So the promontory of the sacrum, or upper part of the sacrum, as it's kind of curving, or it's more anterior located and is more above the pelvic cavity, you can take the upper part of the sacrum as the roof of the pelvic cavity. Just this bit of it, this much.
The promontory.
Yeah, would be the roof of the pelvic cavity. That's it. Again, that would be more of detail, but would be good to know it. Any question about it?
Roof of the
Roof of the pelvic
true
cavity.
pelvis.
Yeah, exactly.
Lesser pelvis. Pelvic cavity.
So, we talked about the anterior wall, we talked about the posterior lateral roof, and also lateral walls. The next thing is the pelvic floor. So pelvic floor is formed by a muscle which is called levator ani muscle. So this guy is composed of two muscles itself. So if you look carefully here,
Not three muscles. Three muscles.
wait up. So the thing is that,
Three muscles of what?
wait up, levator ani plus coccygeus muscle, alright? So we've got two major muscles. And levator ani muscle, which is a major muscle of the floor, it's composed of three muscles. So check it out. The whole thing here, all these guys, which I'm coloring here, these are gonna be the levator ani muscle. Okay? And the thing is that it's composed of three muscles. Right posterior to that, or better to say, easier way, you know the piriformis. Right anterior to the piriformis, there is a muscle from coccyx toward ischial spine, which is here. This is called coccygeus muscle. So coccygeus plus levator ani muscle, these guys are forming the pelvic floor.
Is it the same pelvic diaphragm?
Pelvic floor is same as the pelvic diaphragm, exactly. All right. So levator ani muscle is the one closer to the rectum. Let me make it easier. New Persian word. In Persian, an means shit. Rectum contains shit. So levator ani muscle, or if you want to say ani, so make it easier for you. This guy is around the rectum, so it's closer to the rectum, so it's closer to the shit. So it would be your new Persian word for the day. Okay? So that's pretty much. Now let's see what are the, let's say, parts of the levator ani muscle. The thing is that, before I move on, so where you've got the levator ani muscle, so you've got the rectum passing through it, through part of it, anterior to that. There is a part, that's the case of the male, alright? There is a part between the medial borders of the levator ani muscle, right posterior to the pubic symphysis, that the urethra is passing. That's the case of the males. In the case of the female, is the urethra plus vagina. It's passing through this space, which is called urogenital hiatus. Okay? So this is space that you have it here. It's called urogenital hiatus. If I move it down, so all the walls of the pelvis, everything I said is written here. Now, if you're looking at this picture, so it's just focused on the pelvic diaphragm or pelvic floor. So the most posterior muscle is coccygeus, this guy over here, or this guy. So from the side of the coccyx and lower sacrum, you attach to the ischial spine. Okay, so this is an inferior view. Alright? So that's gonna be the coccygeus muscle. The rest is gonna be the levator ani muscle. Levator ani, as I said, is composed of three muscles. So the first part is this guy, having the attachment to the pubic bone, going around the rectum. Alright? So this part is gonna be called as puborectalis. So the part which is around the rectum. Show it like that. So puborectalis is really important, like anatomically. What's the function of the rectum? To store the, let's say, stool. Okay? So if you're looking at the lateral view here, you see puborectalis is forming a sling around the anorectal junction. So once you have the puborectalis muscle, means above it you have the end point of the rectum, and below it you have the anal canal. Okay? So what happens? How would you store the stool in the rectum? So you need an angle to be formed, because otherwise, if the rectum was just straight going down, so there wouldn't be a way to, let's say, store the stool. So then, puborectalis muscle, as it forms in a sling around the rectum, so it wraps around it, so it forms a kind of like 80 degrees of angle.
Again, sorry, what's this puborectalis? Okay, sorry.
Yeah. Okay? So you've got near 80 degrees of angle formed at the anorectal junction. That's how you can have a better storage of the stool. Okay? So what happens if any of us, we want to do urination or defecation? So the muscles of the pelvic floor should be relaxed. Otherwise, like these guys are kind of compressing the structures to keep them in place. So then you relax the muscles, and then we can have a defecation or urination to be happening. So puborectalis is kind of important. Have you seen those older toilets? I don't know, let's say in Middle East, the ones that you have to sit on them,
Yeah.
not like the toilets that we have here. Have you seen pictures? So let's say in older, maybe like Islamic countries,
Yeah, the ones where
the toilets, they're like, you're basically,
not really.
you're
Yeah, exactly.
sitting like this.
Not
Okay?
really.
So it's not like this. Okay? So
They
actually,
say they're more healthy.
anatomically, once you're giving the angle of more than 40 degrees to your hip, it causes puborectalis muscle to relax more or better. So it decreases the angle. From the other side, it fucks your knees. So that's the
But
thing.
it's
That's
not
why
really-
even for these, let's say, sorry, we can call it as European type of toilet, they could take a small, I don't know, like chair, I don't know, with 4 legs to put under the legs, so you give more angle to the hip. So it would be more healthy, and because if the rectum is not completely empty, so feces stays there more and more and more, and in long term, it could increase the risk of cancer. In really long term, but theoretically. There are more important risks than,
Smoked meat, smoked food.
no, that's for the stomach.
Okay.
But the major thing is the sphincter, the anal sphincter.
Yeah, definitely. Okay? So, that's pretty much.
So you can't say you Arabs in front of Jay.
So,
It might be technically
Pubo,
true.
puborectalis is going around the rectum. The second muscle is going to be a bit more laterally located. Also goes, or also originates from the pubic bone. From the other side, there is something else which is important as an origination point. We have it in this other picture here. What is this muscle here on the lateral side? Obturator internus. There is a fascia covering obturator internus called obturator fascia. Okay, it's different from obturator membrane. Obturator fascia, along the way between the, let's say, pubic bone and the ischial spine, it becomes thickened, okay, and it forms a kind of tendinous arch, as you see here. It's written over here. And we call it as tendinous arch of levator ani muscle. Means that there are parts of the levator ani muscle attaching to this tendinous arch as an origination.
Obturator fascia.
Is the thickening of the obturator fascia. So the important thing about it is that, you see, here you have puborectalis. Then this guy is pubococcygeus. Okay? So from the pubic bone and also from the tendinous arch. It originates, and then in the midline they join together. So both sides, right and left. So they form a ligament or body between the, let's say, anal canal and coccyx. This is the one. We call it as anococcygeal body or anococcygeal ligament. It's like a raphe again. So here in the midline. So coccygeus muscles, they meet with each other in to form a raphe in the midline, which is called anococcygeal body over here. Are we good?
Which muscles are you?
Pubococcygeus muscles.
Just
Just these ones, yeah. Are we good so far? And the last one, the last part of the levator ani muscle is this guy here, which is called iliococcygeus. Iliococcygeus mainly originates from the tendinous arch, which I showed you, which is not here in this picture. And then it attaches or inserts to the coccyx and again to the anococcygeal body. So the third one is going to be iliococcygeus. And at last, again, as I said, you have the other muscle, which is the coccygeus. From ischial spine to the coccyx and the sacrum. More details. If you're looking at this picture, on the left side you have the case of the male. On the right side you have the female in the urogenital hiatus. In the male, check it out here, you have got the prostate gland, because this is the inferior view, so you can see the prostate from down there. So here's the prostate gland, and here is the urethra passing through the prostate. In a female, instead of that, you've got the vagina passing through it. Anterior to it, in the female, you have the urethra. So this is the urogenital hiatus. The thing is that from pubococcygeus muscle, the second one, which I mentioned. So first one was puborectalis. Okay, so at the very originating point pubococcygeus, they are kind of like same, because all of them are sticking to each other. So theoretically, which you don't really see it on the cadaver, from pubococcygeus muscle, there are some certain muscle fibers running toward the certain organs down here in the middle. Okay? So you see these muscle fibers, the tiny ones, running from the levator ani to the rectum. So this is gonna be, this is the inferior view, so to the anal canal. This is gonna be puboanalis, both in male and female. Between the anal canal and let's say urogenital hiatus, later when I'm talking about the perineum, we learn that perineum is a kind of diamond-shaped region like this.
Sure, what is the perineal body I see here?
That's the thing. Where you have the ischial tuberosities on each side, if you draw a line passing through the middle of the perineum, in the very middle is called central point of the perineum, over here, okay? And that's the location of a structure, which we learned again in perineum, called perineal body. So it's called perineal body, okay? Perineal body is a kind of mixture of elastic fibers, collagen fibers, and it's a perfect place for attachment of the muscles to it, okay? So it's doing a lot of things. Or even the pelvic fasciae, the deep ones, they are also attaching to the perineal body. So this small star that you see in the middle, that's the location of the perineal body. Is there?
Two bodies.
It's there in both male and female. Okay?
No, but also this one, the raphe.
But that's the anococcygeal body
Yeah.
or
We have
ligament.
two.
So these are totally different,
Yeah.
but perineal body is really important one. And now, again, both in male and female, you're able to see some muscle fibers running toward perineal body. So then you call that as puboperinealis. That would be the name of it. So these guys here. Okay? Then we continue. In the case of the males, you find some muscle fibers running toward the prostate gland. So how would you call it? Puboprostaticus. So just, you see, you are just putting the names after each other. We are not doing it's not a big deal. So puboprostaticus in females, we don't have it, of course. But instead, as I said, you've got the vagina over there. So there are a bunch of muscle fibers running toward the wall of the vagina, which is called vaginalis. So basically,
What is the female equivalent of the prostate? There's no.
there is,
That's not exactly my strong point. So let's see.
I think it's gonna be paraurethral glands.
Okay. Cool. Yeah, that's right. Okay.
Okay?
Yeah, yeah. Very good.
It's paraurethral glands of the female. So check it out here. Again, from pubococcygeus we have these muscle
But
fibers.
male also has pariurethra glands. Para and pelvi and
No, those are like urethral glands,
And,
but paraurethral glands
in the
would
slide
be-
of history.
would be the equivalent. I think.
No, in the woman it's equivalent to the person.
Yeah,
Okay. And males
same,
don't have
same
it?
origin.
Maybe they
Males
do.
don't
I
have
don't know.
I'm gonna check it out. I forgot that.
Yeah, that'd be nice. Thank you.
I will check it out.
This
again.
might even help me.
Yeah.
next
Because
time
then
I
it
have
means
more.
that the slide of history is only for the female urethra. But you need to check. Because the glands.
Maybe we'll check it out.
That's
So,
right.
pubococcygeus, right, would give you these three different muscle fibers. In the male, puborectalis, puboperinealis, puboprostaticus. In the females, puborectalis, puboperinealis, and pubovaginalis. So there is the only difference is prostate and the vagina. That's it. So that's pretty much about these guys. The table related to the muscles of the pelvis. All of them are related here. So lateral wall obturator internus, everything about it, posterolateral wall piriformis, and floor, coccygeus, and let's say levator ani muscle. Okay. So that's pretty much. And mainly the levator ani muscle is innervated by mainly coccygeal plexus. Okay, S5 and coccygeal nerve together. So you get the
There's
nerve.
only one coccygeal nerve, right?
Yeah, and you get the nerve to levator ani muscle.
Is it
That's
the
it.
third structure? Or?
Yeah, two coccygeal nerves, one on each side. Are we good? So pelvic floor is completely done. So I think I will stop the recording
Okay.
to make it in different